Hey everyone, Dr. Pimple Popper here. Today we're diving into a topic that might make your skin crawl, maggot-infested skin, also known as cutaneous myiasis. This condition occurs when flies lay their eggs on the skin, and the larvae, or maggots, burrow into the skin to feed on the tissue. It can be quite alarming to see, but thankfully it's treatable. Cutaneous myiasis is more common in tropical and subtropical regions. It primarily affects individuals who lack access to proper sanitation or hygiene. It can also be problematic in areas with open wounds or sores, as these provide an ideal environment for flies to lay their eggs. While it's not a common condition in developed nations, it's crucial to be aware of it, especially if you're traveling or working in areas where it's prevalent. Remember, awareness is key when it comes to our health. Knowing about conditions like cutaneous myiasis can help us take the necessary precautions and seek timely treatment if needed. Identifying cutaneous myiasis often starts with noticing unusual skin changes. One of the first things you might notice is a small, red bump. This bump can resemble a pimple or a bug bite, but it's actually the entry point for the fly larvae. As the larvae grow, the bump can become larger and more inflamed. You might even see the maggots moving under the skin. Other symptoms include intense itching, a crawling sensation, and sometimes even pain. In some cases, pus or a foul-smelling discharge might ooze from the wound, indicating an infection. If you suspect you have any of these symptoms, it's essential to consult a medical professional immediately. Early detection and treatment are crucial in managing cutaneous myiasis. Diagnosing cutaneous myiasis is usually straightforward, especially with a trained eye. Doctors rely heavily on the clinical appearance of the affected area. They'll examine the wound and look for signs of maggot activity, such as movement under the skin or the presence of larvae. While the visual examination is often enough, doctors might take a sample of the wound discharge or even extract a larva for microscopic identification. This helps confirm the diagnosis and rule out other possible skin conditions that might present similarly. Early diagnosis is essential for effective treatment. The sooner we can identify the problem, the sooner we can start addressing it and preventing further complications. Section 4. Treatment: removing maggots and promoting healing. Treating cutaneous myiasis involves two primary goals: removing the maggots and promoting wound healing. The first step usually involves suffocating the larvae. This can be done by applying a thick layer of petroleum jelly or other occlusive substances to the wound. This cuts off their air supply, forcing them to come to the surface. Once the maggots are more accessible, they can be carefully extracted using forceps or tweezers. It's important to ensure complete removal to prevent further complications. After the larvae are removed, the wound needs to be thoroughly cleaned and disinfected to prevent infection. Your doctor might prescribe antibiotics to combat any existing infection and prevent future ones. Pain management is also an essential part of treatment, as the wound can be quite painful. Section 5. Preventing maggot infestation. Tips for personal and environmental hygiene. Preventing cutaneous myiasis is much easier than treating it. Maintaining good personal hygiene is crucial in deterring flies from laying eggs on your skin. This includes showering regularly, especially after spending time outdoors. If you have any open wounds or sores, keep them clean and covered with a bandage. This prevents flies from accessing the wound and laying eggs. Additionally, be mindful of your surroundings, especially in areas where flies are prevalent. Using insect repellent, wearing long sleeves and pants, and avoiding areas with poor sanitation can significantly reduce your risk. Remember, prevention is always better than cure. Section 6. When to seek medical attention. Don't delay treatment. It's crucial to seek immediate medical attention if you suspect you might have cutaneous myiasis. Early detection and treatment are vital in preventing complications such as severe skin infections and tissue damage. Don't attempt to remove the maggots yourself, as this can cause further injury and increase the risk of infection. Leave it to the professionals who have the tools and expertise to handle it safely and effectively. Remember, cutaneous myiasis is a treatable condition. By understanding the symptoms, taking preventative measures, and seeking timely medical attention, you can effectively manage this condition and ensure a speedy recovery. Stay safe and